Let's get more updates from DOH Assistant Secretary Rosario Vergeire. She is joining us over the phone. Ask Vergeire, good afternoon.
Hi. Good afternoon po. Yes, good afternoon.
So first off, let's ask how the conditions are of these 3 repatriated Filipinos who showed symptoms of the COVID-19. Some of the reports are saying they are sick, but they have tested negative so far. Can you confirm this?
Yes, we have 3 repatriates now who have been brought to our referral facility in Region 3 because they experienced signs and symptoms. 2 of them experienced sore throat and 1 of them experienced non-productive cough. As of last night, we were able to get already the results of 2 of them, and it turned out negative.
Mm-hmm. Right, just as a follow-up, when do we expect these results to be... when do we expect the other patients' results to be released?
We are expecting the results of the last patient within the day.
All right. I just want to ask actually, Asec Vergeire, because of all these possible cases and persons under investigation that we have, how many facilities, medical facilities or labs are actually capable of testing for this virus?
We only have 1 reference laboratory here in the Philippines. It's the Research Institute for Tropical Medicine. But as we speak now, we are preparing to have our subnational laboratories functional, and these are 5. 1 in Davao, 1 in Cebu, 1 in Northern Luzon, and another 2 here in the National Capital Region. We also are now partnering with the UP NIH so that we can also extend our laboratory capacity with our private counterparts as well as with government.
So going back to the repatriates, what's the plan in case 1 or some of them would test positive for COVID-19?
So they would just be managed, and if ever 1 of them would turn positive, they would be managed in a reference facility, wherein a reference facility is capable of managing that. And of course, we would have this strict surveillance.
All right. What about contact tracing, Asec? I personally took 2 flights last week via 2 different airlines, and 1 actually provided me with a form and the other one didn't. So I cannot imagine how difficult it is to contact trace. How have you been doing on that front?
Yes, with the first 3 cases of COVID-19 here in the country, these first 3 COVID-19 positive cases, we were able to trace as much as 65% of those who apparently has had exposure with these positive cases. Unfortunately, most of the details that were provided to the airlines were erroneous or incomplete. That's why some of them were not traced at all, and some of them were reported already to be out of the country the moment that we started contact tracing. So for now, we have considered that this contact tracing has already ended, though we are still monitoring on the different locations that they have identified and given to us. But because the incubation period of 0 to 14 days have already ended after they were exposed. So now we have shifted our strategy into just waiting for developments, and if and when somebody turns out to have signs and symptoms among all of those being monitored, we are just going to manage them accordingly.
All right, thank you for making that extra clear to us. Now I want to ask about the Koreans who flew in from Daegu City in Korea via Cebu. Have you gotten in touch with them, or what's the situation with them?
Yes, our regional offices, ever since they have landed in Cebu, have already started tracing these people, these Koreans who went to 2 different places in Cebu. So now they have been advised to stay inside their hotels to do quarantine, and they are being strictly monitored by the local government unit.
All right. Just so everyone's clear on this again, Asec, what exactly is monitoring all about? When you say you're under being monitored, but you're not under quarantine, does this mean you can go anywhere? You can, go to public places or what, with a mask perhaps? Or is there a definition, at least in this context specifically?
Yes. When you say we are monitoring, there are classifications of what type of patient or person you are. So there would be these patients under investigation wherein you already have shown signs and symptoms, you have history of travel to the to those countries that we have issued out restrictions. And sometimes, or if you have exposure. So these are the patients under investigation. Now, if you are a person under monitoring, it means you do not have any signs and symptoms, but might have that history of travel, or you might have history of exposure. So these persons that are under monitoring because of this history of travel or exposure are advised home quarantine. So when we say it's home quarantine, it is monitored, meaning their details are being listed. The regional office of DOH as well as our Bureau of Quarantine are directly coordinating with their local government units. Local government units, in turn, they activate or mobilize their barangay health emergency response teams. These bursts, which they call, would be the ones mobilizing their personnel to go to the specific persons that we have identified for monitoring. Sometimes it can be through text or calls, not face-to-face, but we do our monitoring, especially for these home-based quarantine persons, regularly. It's daily, actually, to check if they are developing signs and symptoms.
Right. Asec, talking about persons under investigation, do we have an update as to exactly how many PUIs there are right now and how many have tested positive? At the same time, I'd like to find out what you think about this news story that there was this patient who was negative, who again tested positive. Should that be a cause for concern?
Yes, as we speak right now, our current patients under investigation is totaling to 30. 30 PUIs hospitalized or admitted in the different hospitals in the country. We still have 3 positive cases, still no additional ones. These are all imported cases, and we still do not have local transmission. As to the issue or the stories about recurrence, as they say, in other countries where a previous negative patient turns out to be positive, we still do not have enough evidence for us to say that this is an accurate report. These are experiences coming from different countries, and it's still being noted and observed, and it has to be studied well before we can rightfully say that there is really this occurrence of recurrence, in this kind of disease.
All right. Thank you so much for shedding so much light on this COVID-19 virus here in the Philippine context. Thank you, DOH Assistant Secretary Maria Rosario Vergeire.